Hi everyone, welcome back for another segment. Today we are going to be showcasing my personal favorite procedure that we do in our office, filler. Like, who doesn't need some filler? Just a little pick-me-up, a little refresher. Goes great with our laser treatments as well too. So today we'll be going into room 6. I'm going to be joining Dr. Heather Richmond. Dr. Richmond has been practicing for over 10 years. Board certified dermatologist. She also did her residency with MD Anderson. We love her here. She has been with their practice for over 2 years, so I'm super excited for us to be joining during her treatment. So like I said, we're gonna walk into room 6. I think she's just finishing up consulting her patient. But again, do not forget to enter our giveaway. All of the information you guys need will be linked in the description box. But again, remember 3 simple rules. All you have to do is follow all 3 of our providers. So make sure you're following Dr. Heather Richmond, Dr. Paul Friedman, and Little Skin Guru. Make sure you're like your most wanted procedure and also tell us why. We want to know why that is your favorite and why you would like to try it. So let's go ahead and get in here and check on Dr. Richmond.
Hi. Hi, everybody. Nice to see everyone. I'm Heather Richmond. So today we're going to be working on facial structure and just trying to really naturally augment our already beautiful patient. So the area that she says that bothers her is the chin area. So what I'm going to try to do is try to improve the chin baseline structure, which on profile is going to help with this underneath. And so also we're going to put some volume into the lateral cheekbone, which is going to help pull up from the side. So if we can elongate her chin forward just a little bit and give a little bit of natural looking volume in her chin, the goal is to improve the contour of her jawline. So I've drawn out a little bit of a plan over here on this side, and I was going to draw the other side here. So on the cheekbone, there's just some direct injection points where we use here.
And Dr. Richmond, as you're doing your markings, and you're saying we're using filler today to correct. So what are some things that filler can correct as far as, like, you know, just natural gravity just bringing us down, and of course fixing, you know, giving us a pick-me-up with filler and restructuring the face?
So yeah, we do a lot with filler. I'm sorry, I need to raise her up a little bit over here to get to this chin on this side. So right now we do a lot of full facial volumization with filler. So some patients, you know, when they're younger are just looking for lips, for example. So we do lots of lips. Patients are really interested in that. Tear troughs, so the area under the eye. As patients get older, this tends to get more hollow, and is an area that I think creates a huge benefit from just doing a little bit of filler. And so those are the areas I'm going to be injecting. We do a lot of cheeks, which is helpful in the majority of patients, nasolabial folds. But right now, I think the paradigm with filler is really to first give everybody a good facial structure overall, and then fine tune where patients are seeing the wrinkles. So if you come in and see me and say, I'm bothered by this area, I might suggest that we do filler here or down here, and then top it off with a little bit in the area of concern. So it's not always about just going what you're seeing, it's about giving you the structure that's going to support the better facial you know, dynamic.
Yeah, that's awesome. And I think that's also a lot of things that people don't know is, you know, trying to correct just one area doesn't mean that we're gonna need, you know, filler on any other areas of the face too.
Right.
So I love that you pointed that out. So as far as, like, you know, treatment wise, what do you find patients, like number of syringes, or what is usually kind of needed on average per patient?
So it really depends what we're doing. Most patients, you know, will use at least one, but if I'm doing cheeks or if I'm trying to give sort of skeletal structure, it's not uncommon for me to inject 2 to 4 syringes, and you can't even do more. So you know, sometimes we'll do it in stages where we'll make sure that we start with the cheek structure, because that's usually the number one most important area for the facial volumization. And then we'll potentially do lips on another day or chin on another day. But some patients will do a lot at once. It just kind of depends on what you're up for and what your budget is, etc.
Yeah. And one of the things I personally really love is, you know, you're all about natural looks and just enhancing that natural beauty, just giving it a little bit of pick-me-up, right? So I think it sounds scary when we're saying multiple syringes, right? But not to worry, you know, Dr. Richmond is great about giving very natural results and still giving you that change you're looking for, you know, and like that restructure.
For sure. So I really listen to my patients as far as what they're comfortable with and what their goal is. And what you have to realize about one syringe is it's actually very little product. So people hear the word, you know, 1 syringe, 2 syringe, 5 syringes, and it sounds like a lot. But 1 syringe is 1 milliliter, which is actually 1/5 of a teaspoon. So if you do 5 syringes, that's only 1 teaspoon of volume. So it's really actually small amounts that we're just trying to put in exactly the right place to give you the best dynamic change that you're going to see it in the mirror. But most of the time, filler is very subtle. It's going to make you look more well-rested, just overall rejuvenated, but the goal is subtle.
Yeah, perfect. And so filler has hyaluronic acid, right, which we naturally already have in our body.
Correct.
What does it do, like, as we age, you know, that natural hyaluronic acid starts to decrease, right?
Yes, to some extent. So hyaluronic acid is in our skin as a natural moisturizer. We are not necessarily putting the hyaluronic acid filler in the same places that we naturally have hyaluronic acid, but the idea is that it's a very benign inert substance that has very little side effects. It degrades slowly over time, and it's very safe.
Perfect.
Okay. So I think we can start with injecting. Okay, 1, 2, 3. So how was that first injection there?
Not bad at all.
Not bad.
So she did also numb for a good 45 minutes, which we do routinely with all of our filler patients. The filler also has lidocaine in it. Is that correct, Dr.
That is correct.
Okay,
yeah.
awesome.
So it will numb over time as we inject.
Perfect. And what can she expect post-procedure? What is her care going to look like?
So the most common thing that I caution patients about is bruising. So there is a sort of common side effect of temporary bruising. However, you know, we do our best to minimize that as much as possible. We'll ice afterwards. You can have some swelling, which is temporary. The product itself draws in water.
Okay.
So usually the day that we've done the treatment, you might be a little bit more swollen than you will be 2 weeks later. So it's usually less volume than you see immediately afterwards, but not that much less, depending on the product.
How long do results typically last?
It depends on the product as well. So Voluma is generally, we say, about 2 years. Some of the other ones are more like 6 months to a year, so it just really depends a little bit on what you're doing.
Right.
But it also varies from patient to patient, how quickly it goes away. I think the more, you know, patients who exercise a lot, for example, with higher metabolisms might have it go away a little bit more quickly. And it depends what part of the face you put it. So in the more dynamic areas, like around the mouth, it might dissolve more quickly than in, for example, the tear troughs where there's very little movement. I find filler lasts very long in those areas.
And which product are you using today?
Today I'm using Voluma, which is one of the thicker hyaluronic acid products. It's really good for bone contour and restructuring, and it is the one that lasts the longest of the ones that we have.
Okay, awesome.
Yeah.
Well, she's looking great already.
So I'll do one more here, and then we're going to move on to a different injection technique.
So again, please do not forget we're having our very first virtual open house. Buy more, save more special. You can save up to $800 with your treatments. This is something great to take advantage of if fillers is something you've been wanting to try. Like Dr. Richmond said, of course, you know, don't get scared. Sometimes multiple syringes are needed. And I do also want to assure you guys, if you have not already seen it, Dr. Friedman has an amazing COVID-19 video on his page in regards to all of our procedures and everything we are doing to ensure our patient and staff safety. So if you guys would like also some more information on that, please look at Dr. Friedman's page. And of course too, you're always more than welcome to call to see what protocols and precautions we are taking here at the office. How are you feeling? Good. Good? Is it any like uncomfortableness? Nothing?
Don't feel
Are you excited to see your results?
Yeah.
Okay, awesome.
See the after. So I'm always just very careful to clean very thoroughly. We use a surgical scrub called HIPAA. We also use alcohol.
So we'll let Dr. Richmond finish. You know, we'll definitely post our before and after pictures of this. I'm super excited for her to see her results. And again, please do not forget about our buy more, save more special where you can save up to $800 on the treatment. And be sure to follow us for our next segment where we'll have some more information and cool procedures that we do here at the office.